My last video, I showed how I lost 70 pounds on Tirzepatide, but I deliberately left out one of the most important parts, how the dosing actually works. So let's get to that. So your box finally showed up, the vial and the syringe. This part 2 of everything I tell my patients before their first shot. In part 1, I showed you what this medication actually is. It quiets the food noise. It slows your stomach down. That's how the weight comes off. If you missed it, the link is below. Go watch it. Today, the dose and the shot itself. The dose ladder and why the top number was never the goal. Why the units on your syringe are not the milligrams. That one confuses everybody. And how to give yourself the injection without guessing. From somebody who prescribes these every week and takes one himself. Step 4, know the dose. Semaglutide starts at 0.25 milligrams once a week, and it steps up over months towards 2.4 milligrams. Tirzepatide starts at 2.5 milligrams once a week, and it steps up towards 15 milligrams. Those are the approved weight management step-up schedules from the companies that made the medication. They are not my recommendation for you. Your provider sets your ladder and decides how fast you climb it. Here's what people get wrong. They see the top number and they want to get there. The top number meaning 15 milligrams for Tirzepatide, 2.4 milligrams for Semaglutide. Most early on and right after a step up, you'll get side effects. In my practice, the people who struggle the most are usually the ones who climb the fastest. And here's the part nobody says. Not everybody ends up at the highest dose or needs to be at the highest dose. I've had patients do great for months on the lowest dose there is and never need to go any higher. And I've had patients who needed even less than the lowest dose on the label just to feel comfortable on it and was able to lose weight on it. For me, I was on 2.5 milligrams of Tirzepatide for 2 months easily and lost at least 20 pounds off of that from I remember. And I have patients that lost even more than that on the lowest dose. So I'm not exaggerating, that is true, but everyone is different. So if you're losing and the food noise is quiet, tell your provider that. That's the information they need to set your dose. There's no prize for hitting the highest dose on the label. And real quick, if this is helpful, hit subscribe. I put one of these out every week. Back to it. And quick disclosure, I run that practice. So if you're hearing this from someone who has a stake in it, I'd rather you know that than not. If you're stuck on a dose, dealing with side effects, or trying to figure out if these shots are right for you, don't guess. Go to glp1drlee.com. or call or text 945-800-6021. My team and I evaluate your history directly, so you have a real medical plan behind your prescription and medication. Step 5, know the shot. This is a part that stops people before they even start. It goes in the abdomen, the thigh, the back of your arms. The needle is very tiny, about 1/4 of an inch. And I tell you what I tell every patient who's nervous. I do this to myself. Honestly, I wasn't crazy about it either at first, but once I actually did it, it didn't hurt. I didn't even notice it. And many of my patients say the same thing. They didn't even feel it or even knew they got the shot. Some people just don't like doing this to themselves, and that's real. I get it. Most people tell me they barely feel it when they do get the shot, okay? Once you inject your pen, you dial it, you click it, and you aim at your skin, and you're done. And you put it either in your abdomen, the back of your arm, or your thigh, and it's done. Pretty hard to get wrong. And some of you get a vial, a little bottle, and a separate syringe. You draw it up yourself from the label you get from the company. And if that sounds familiar, it's because that's exactly what a diabetic does with insulin. Same little bottle, same kind of syringe. So let me say this clearly, because this scares people. This is not insulin. It looks like insulin, it draws up like insulin. It is not insulin. If somebody gets an insulin dose wrong, that can drop their blood sugar. On its own, a GLP-1 doesn't do that. The one exception, and this matters, if you're also on insulin or one of those older diabetes pills like a sulfonylurea, then low blood sugar is a real possibility, and your provider may need to adjust your dose. That's a conversation to have before you start, not after. Now back to that vial, because here's the thing that confuses more people than anything else. The milligrams and the units are not the same thing. The milligram is the medicine. Units are the little lines on the syringe, and how they match up depends on your vial. The same dose can be a completely different number of units. in a different vial. You never take the number from a video, including this one. You take it from your label. It's printed right on the package. One tip I tell people is when you get your package, you want to get your phone out and take a picture of the package label. That'll tell the units, the milligrams you're on. In case you lose it, you'll have that for reference to talk to us or your provider to help make sure you know which dose you're getting. Just my FYI to you. Take it or leave it. Then if you're still not sure with the package information, call whoever prescribed it or the company that sent you the package. That's not a dumb question. My team walks people through it every time. And if the place you bought it from won't get on the phone with you or won't return your messages and won't walk you through your first draw, that tells you something about where you bought it. And one more thing, you don't have to do your first one alone. Some doctors' offices will do your first shot with you right in the office. Honestly, not many offer it, so here's what I'd ask any of them. Who's managing your medication? Not who gives a shot, who adjusts your dose. Who do you call when the nausea hits? If nobody there can answer that, keep looking. And if you're in the Dallas area and want somebody to do your injection, we can do it in person. Right here at the Fountain of Youth Med Spa, our weight loss clinic in Allen, Texas, just outside of Dallas. If you're afraid of needles or just not sure you're doing it right, come on in, we'll take care of you. We'll do the consult and get you set up and give you that first shot right there. So you see exactly how it's done by a real person. But for most of you watching from wherever you are, you can do this right from home from the package we send you. If you just follow the directions that come with it and everything I've walked you through here. Whatever makes this easier for you, the link's in my description. Here's the last piece and explains the whole schedule. Your own gut already makes these hormones, the GLP-1s, made right there in your intestines, released into your bloodstream, just a small amount every time you eat. Your body's been doing this your whole life. The problem is they don't last. They're only there for about 2 minutes, then they're gone. So the drug company built a copy, one that lasts much longer in your body. The copy stays with you about 7 days. 2 minutes, that's your own body's natural GLP-1. 7 days, that's the medication staying with you the whole time. And for those 7 days, it's doing exactly what we already talked about. Quieting the food noise, slowing your stomach down the whole time, which is exactly why it's a once-a-week injection. Pick a day, which day? Honestly, there's no right or wrong answer. What actually matters is that you keep that day. Staying consistent, staying committed, that's the key. Because the whole point is a steady, constant signal. Missed doses, take it whenever, and you lose the one thing that makes it work, the constant signal. So keep that shot day consistent. So here's where that leaves you. You know the ladder, you know the shot, and you know the number on your syringe comes off your label on how to dose, not off a video or a friend. That's enough to start, and to start without guessing. There's one more part, and honestly, it's the one I want most of you to hear. Not everybody should be on these. There are people I turn down. There are histories where this is a hard no, and a few where I stop and check before I write anything at all. That's part 3, who should not take these medications, and a hard stop. If you're one of these already, or you're about to be, that's the one to watch. I'm Dr. Lee, I'll see you in the next one.